Hi, this is Dr. Muhammad Ali from Implants Pro Center, and we are going to talk today about why dentures are not long-term solution for people who lost their teeth. People who have dentures, probably you know that dentures are painful. A lot of times when you try to chew with them and to eat, and they come out, and I hear stories from my patients who been living with dentures, how difficult it is, and each one has his own story or her own story. That's why dental implant or implants are a solution for people to not have dentures as final restoration for their lost dentition. So we're gonna talk about 3 reasons today. When you lose your teeth and you have dentures as a replacement of your teeth, you're gonna lose 500% of your ability to chew. With that, you're gonna eliminate a lot of different foods from the menu you can eat every day. So you want to have good balanced nutrition, and you want to enjoy life and enjoy eating food with confidence. And you don't want to be isolated from the society around you. Having a culture around us where, we enjoy food with our friends, our family, it's just genuine, part of our social interaction. So to eliminate foods because you can't chew them and you cannot eat them, and then when you eat you don't feel comfortable and your facial expression doesn't come as you are comfortable eating this food or that, it will affect basically the relationship with the people around you. Not to forget that you have to go right after you eat to the bathroom to clean under your dentures. The inconvenience basically of having dentures in your mouth over having dental implant solution where instead of having denture resting on your gums and your palate and whatever, you have your teeth attached to implants inside your jawbone, so you can eat and function just as if you have teeth. The lack of nutrition over a long period of time will have its toll on you, and it will have its toll also on your lifespan basically. So if you don't have good nutrition, you are not going to be able to maintain your health and your longevity in life as if you do have good teeth and you eat and function. Not to forget the confidence and the psychological aspect of having something mobile, and you are afraid if you sneeze, if you jump in swimming pool, in whatever, those dentures might fly out of your mouth. When you have dentures, they're gonna affect your taste. So basically, they will cover your palate. There are a lot of taste buds in your mouth and in your palate, and they're gonna cover those taste buds. So you're not gonna be able to taste food the way you do. And they're gonna affect your speech. If you are trying to have a conversation, you're gonna lisp. You are not gonna be able to pronounce certain letters, and your pronunciation is gonna be affected. And that also is gonna have an impact on your social interaction and your social confidence in general. Not having dentures and having dental implant solution is gonna allow you to be more at ease carrying conversation and speaking and pronouncing letters, just like if you do have your own teeth. That is a big key for people not being able to speak or pronounce. We are at Implants Pro Center, very happy to consult you and explain to you your treatment and the possibilities basically to have something fixed in your mouth and something feel and function just as if you have your natural teeth. So please don't hesitate to contact us through our website at implantsprocenter.com, or you can contact our office at 415-391-7751. Dentures sit on the gums, and they compress the bone externally, where dental implants are placed inside the jawbone. Now, the jawbone gets stimulated to maintain its volume and not to shrink internally. So when you place implants, just like if you have the roots of your teeth, the bone volume is going to be maintained, and dental implant fixtures will function as bone volume stabilizers, where when you don't have teeth and you have only denture resting on your gums, compressing your bone externally, you're going to start to lose bone, which could be as much as 50-60% in the first year after you lose your teeth. That is also a big consideration for you to not think of dentures as permanent solution. Disuse atrophy will happen because you lost the internal stimulation of the bone, just like when your bone is not functioning. Just think of when you have a cast, when you fracture your hand, when you take the cast off, your bone feel weak and your muscles feel weak and all that. For you to maintain your bone volume and to maintain the muscle functions and all that, dental implant can be a very good solution for you over having dentures. The disuse atrophy could get very severe to a point that sometimes you can end up with spontaneous fractures, especially in the lower jaw, because you lost all the bone volume and there's no bone anymore to basically keep things safe for you. So some people end up sometimes with spontaneous fracture, especially in the lower jaw, in the mandible, or could be by small accidents such as getting hit by a door as you are coming out of public bathroom or whatever. So simple accidents like that could have big consequence, of jaw fracture. All that because of disuse atrophy. So that is a big reason also for you not to have denture as permanent solution. If you do have dentures and you would like to discuss and talk about your options, please contact Implants Pro Center through our website or through direct telephone 415-391-7751. Thank you so much, and we'll be talking next time about a different subject. Thank you for listening.